Okay, so you came in today with some low back pain.
Sure.
And this started a couple days ago when you slipped on the kitchen floor and caught yourself. You didn't fall, you caught yourself.
Yeah.
And you told me your pain is what? And the low back is 0 to 10, you rated it as?
3.
3,
Yeah.
Okay. And it's on the left side?
Yes.
Okay. So we've done an examination. What we found is that she's twisted her pelvis in that slip. And so one leg is presenting longer than the other. And so what we're going to do is a protocol that I use to correct that. So I'm going to have you go ahead and lay face down for me. So what we found is that her left leg is shorter than her right leg. Let's have you lift up in the middle, kind of do a push-up so I can slide this underneath you. There you go. What we're going to do is place blocks underneath the pelvis to untwist that pelvis. And the blocks are placed opposite of the way that her pelvis is twisted. So now her legs are equal. Now what we find is that twisting of the pelvis causes tension in the muscles all the way up the spine, and that can carry all the way up to the base of the occiput there. So we're going to check her occipital base to see if it's also tipped, which it is. It's low on the left, which is usually what we see. So we'll tap that up. You're going to feel a little tap here. And that's the first thing we do after blocking the pelvis to start to unlock this. So now her occiput is no longer twisted or tipped down on the one side. We're just going to do some massage, light massage on the muscles along her spine to kind of get those relaxed a little bit. And what's happening right now while we're doing this, because we've unlocked it by adjusting the occiput, now we're relaxing the muscles. She's on these blocks, so the weight of her body's laying on those blocks. That's actually unwinding her pelvis while we relax these muscles. And so what we found is that we can get a correction of that pelvic twist, that pelvic rotation, without doing a popping or an adjustment, a forced adjustment, which is much more comfortable for the patient and less fearful, especially because this is her first time ever to a chiropractor. There's always some apprehension with that, and that's normal. So we're going to use the impulse adjuster, and we don't just do that area, we're going to do full spine. So I'm palpating each segment to see where fixations are, where malpositions are. We're finding that right here there's a little bit of rotation. We're at T7. So is that tender when I push there?
A little bit.
Yeah, there's a little tenderness there. So what we're going to do is we're going to go ahead and tap that one. Restore motion in that segment there. Does that feel better?
Mm-hmm.
Good. All right, we'll go down a little bit more. Okay, we have another segment here that's fixated, not moving properly. This one's also got a little bit of an extension malposition to it, so we'll give it a little tap on the spinous process. And we'll go out here, down here to T11 and T12. And all this is from that same slip that she had, twisting the pelvis, straining all these muscles. Now what we found here is that she's got, the pelvis is rotated back on the left, but we've got L4 and L5 rotated back on the right. So we're going to go ahead and tap those. Now come to the PSIS on the left. Tap that forward. We also have the sacrum is anterior and inferior on the left, so we're going to come to the right inferior side of that sacrum and give that a tap there to drive that sacrum back on the left. Good. Alright, so we can go ahead and move the blocks now. With the blocks gone, we should have equal leg length now. Whereas the left leg was short before, they're now equal. So let's have you go ahead and get up and tell me how that feels.
Oh, much better.
Much better.
Oh, yeah.
Awesome. That's what we want.
Yeah.